Hello guys, today I'm going to be talking about the hip bone or the pelvic bone. This is our hip bone, right? When we have two hip bones, it is called the pelvic girdle, and when we have the hip bone together with the sacrum, it is called the bony pelvis. So we have the hip bone, two hip bones, pelvic girdle, two hip bones, and the sacrum, bony pelvis. Yes. So the first thing to always do when you're giving a bone is to side the bone, specifically side the bone. Yeah, so I'll be telling us how we are going to side this bone. And there are three things I use to make use of. I use my acetabulum, I use my pubis, and I use my ischium, right? So the acetabulum is directed laterally, the pubis is directed anteriorly, which is facing anterior, and the ischium is facing posterior, just like the way it is. So lateral, anterior, posterior, and this is obviously our right hip bone, as we can see, just where I've placed it. Yeah, so this is the right hip bone, and the hip bone is formed by the fusion of three bones: our ilium, our ischium, and our pubis, and they all meet at the what? At the acetabulum. So this is our hip bone. We have the ilium, we have the pubis, and we have the ischium. Yes, the general characteristics on the hip bone. On the anterior border, we have the anterior superior iliac spine, anterior inferior iliac spine. On the posterior border, we have the posterior superior iliac spine, posterior inferior iliac spine, ischial spine, greater sciatic notch, lesser sciatic notch. Again, anterior superior, anterior inferior, posterior superior, posterior inferior, iliac spine, ischial spine, greater sciatic notch, and lesser sciatic notch. Our obturator foramen, these are obturator foramen, right? So this is the general characteristics of the hip bone. Then I'll go right ahead to talking about each part of the bone, starting from the ilium. Now the ilium is a fan-shaped bone or part of the bone that forms the upper border of the bone, and it is also referred to as the ala of the hip bone, right? It is more like a wing or fan-shaped structure. It has two ends, three borders, and three surfaces. And the borders are iliac crest and the inferior border that fuses with the remaining two bones. So this is the inferior border, is fusing with the remaining two bones. We have the iliac crest, which is the superior border. We have three surfaces. We have the iliac fossa, we have the auricular surface, and we have the gluteus surface. Again, iliac surface, auricular surface, and gluteus surface. Iliac crest, inferior border. Let's go and talk about the iliac crest first. So the iliac crest is made up of two parts, or is divided into two parts. The anterior two-thirds, which is the ventral part or portion, and the posterior one-third, which is the dorsal part. The anterior two-thirds is divided again into three parts: outer lip, intermediate lip, and inner lip. The anterior two-thirds is divided into three parts: outer lip, intermediate lip, and inner lip, right? And it gives attachment to three muscles. The outer lip give attachment to external obliques. The intermediate area give attachment to internal oblique muscle, while the inner lip give attachment to transversus abdominis muscle. The highest point of the iliac crest, placing it in the anatomical position, the highest point of the iliac crest lies at the level of between L3 and L4, and just around that highest point, on the back, we have attachment for latissimus dorsi, and on the front, we have attachment for quadratus lumborum muscle. Again, in front of the highest point, we have the attachment for quadratus lumborum about this region, and behind the highest point, we have attachment for latissimus dorsi. So we talked about the ventral two-thirds or the anterior two-thirds. Then to the dorsal or posterior one-third, the attachment on the posterior side give attachment to gluteus maximus, and on the anterior side give attachment to erector spinae. Again, gluteus maximus, erector spinae. So let's go over all the muscles of the iliac crest. Outer lip, we have external obliques. Intermediate area, we have internal oblique muscle. And inner lip, we have transversus abdominis muscle. Behind the highest point, which is at the level of L3 and between L3 and L4, we have behind latissimus dorsi and in front quadratus lumborum. Then in the dorsal one third, behind we have gluteus maximus and in front we have erector spinae. Just in front of the external oblique, in the anterior one third of the ventral of the outer lip, we have attachment to tensor fascia lata. Just in front of the external oblique, in the anterior one third of the outer lip, we have attachment to tensor fascia lata, right? And tensor fascia lata inserts on the iliotibial tract. So we have an anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. So that is basically all for the part of the iliac crest. We have the inferior border. The inferior border of the iliac crest merges with the acetabulum. It completes the acetabulum, right? Then we have the surfaces. I said we have the iliac fossa, we have the medial auricular surface, and we have the gluteal surface. So iliac fossa gives attachment to iliacus. The auricular surface, we have two parts. The auricular surface itself, or the part that articulates with the auricular surface of the sacrum, and we also have the rough part, which is the tuberosity of the ilium. So we have the auricular surface and we have the tuberosity of the ilium. So the auricular surface articulates with the auricular surface of the sacrum at the sacroiliac joint, and the type of joint that it forms is the plain type synovial joint. And the tuberosity of the ilium give attachment to three ligaments. It gives attachment to three ligaments. So the ligament from behind forward, from posterior to anterior, we have iliolumbar, dorsal sacral ligament, and interosseous sacroiliac ligament. Again, iliolumbar ligament, dorsal sacral ligament, and interosseous sacroiliac ligament from posterior to anterior. That's the attachment on the auricular surface. Then that's all for the anterior surface of the ilium. Then we have the posterior surface. On the posterior surface of the ilium, we have three lines, and they are called the gluteal lines. We have the posterior, we have the anterior, and we have the inferior gluteal line. So this elevation we are seeing here, this is our posterior gluteal line. This rough, not really defined line we are seeing. So this line we are seeing is our anterior gluteal line. Not too obvious, but I'm going to show us a picture. Then this place, also not well defined, is our inferior gluteal line. Again, posterior gluteal line, anterior gluteal line, then inferior gluteal line. That's for the surface. Then to the attachment on the gluteal surface, the posterior surface is also called the gluteal surface. So the attachment of the gluteal surface, we have behind the posterior gluteal line, we have gluteus maximus in this area where I'm touching. So behind the posterior gluteal line, we have gluteus maximus. Behind the anterior gluteal line and in front of the posterior gluteal line, we have gluteus medius. Then behind the inferior gluteal line and in front of the anterior gluteal line, we have the gluteus minimus. Again, gluteus maximus. In between the posterior and anterior gluteal line, gluteus medius. In between the anterior and inferior gluteal line, gluteus minimus. Then this area below the inferior gluteal line, we have our reflected head of rectus femoris just above the acetabulum. Below the inferior gluteal line, above the acetabulum is our reflected head of rectus femoris. And to attachment of the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. So anterior inferior iliac anterior so and so anterior superior iliac spine gives attachment for two things: sartorius and ilio So anterior superior iliac spine give attachment to two things, a muscle and a ligament. A muscle and a ligament. So we have sartorius and inguinal ligament. Sartorius below, inguinal ligament above. Sartorius below, inguinal ligament above. So anterior superior iliac spine give attachment to sartorius and ilioinguinal. So anterior superior iliac spine give attachment to sartorius below and inguinal ligament above. Then we have an anterior inferior iliac spine. Again, a muscle and a ligament. Again, a muscle and a ligament. So the muscle is straight head of rectus femoris and iliofemoral ligament. Straight head of rectus femoris and iliofemoral ligament. But in this case, straight head of rectus femoris is above, while the and iliofemoral ligament is below. Straight head of rectus femoris, iliofemoral ligament. Straight head of rectus femoris is above, while iliofemoral ligament is below. Right? So to the posterior superior iliac spine, posterior superior iliac spine give attachment to sacrotuberous ligament. Sacrotuberous ligament. So we have our sacrotuberous ligament in this area. Right? Now let's go ahead and talk about the the we have three surfaces of the ilium. We have iliac fossa, gluteus surface, and sacropelvic surface. So the sacropelvic surface has two parts. We have the sacral part and we have the pelvic part. So the sacral part is one that contains the auricular surface that articulates with the auricular surface of sacrum, and also it also contains the tuberosity of the ilium. While the pelvic part is one that contains the smooth part that is related to the pelvis, and this gives attachment for the obturator internus. It gives attachment to the origin of obturator internus. So this area gives attachment for obturator internus. Yes. So this is our ischial spine, our greater sciatic notch, our lesser sciatic notch. Our greater sciatic notch is converted into a foramen by a ligament, and that is sacro. The ligament attached this way, it goes up, and that is our sacrospinous ligament. Sacrospinous ligament converts the greater sciatic notch into a greater sciatic foramen, and our lesser sciatic notch is bridged also and converted to a foramen by the sacrotuberous ligament. It goes this way. So we have our sacrotuberous ligament, sacrospinous ligament, right? So let's talk about other things that we can see on our hip bone. We have the pubis and we have the ischium. Let's talk about the pubis bone. The pubis bone is the bone that is located anterior and superior of the obturator foramen. Is anterior and superior. This is where it is placed, anterior and superior. And the pubic bone is, it has I don't know, let me just stop. The attachment of the gluteal surface, we have behind the posterior gluteal line, we have gluteus maximus in this area where I'm touching. So behind the posterior gluteal line, we have gluteus maximus. Behind the anterior gluteal line and in front of the posterior gluteal line, we have gluteus medius. Then behind the inferior gluteal line and in front of the anterior gluteal line, we have the gluteus minimus. Again, gluteus maximus. In between the posterior and anterior gluteal line, gluteus medius. In between the anterior and inferior gluteal line, gluteus minimus. Then this area below the inferior gluteal line, we have our reflected head of rectus femoris just above the acetabulum. Below the inferior gluteal line, above the acetabulum is our reflected head of rectus femoris. And to attachment of the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. So anterior superior iliac spine give attachment to two things, a muscle and a ligament. A muscle and a ligament. So we have sartorius and inguinal ligament. Sartorius below, inguinal ligament above. Sartorius below, inguinal ligament above. Anterior inferior iliac spine, again a muscle and the ligament. Again, a muscle and the ligament. So the muscle is straight head of rectus femoris and iliofemoral ligament. Straight head of rectus femoris and iliofemoral ligament. But in this case, straight head of rectus femoris is above, while the and iliofemoral ligament is below. Straight head of rectus femoris, iliofemoral ligament. Straight head of rectus femoris is above, while iliofemoral ligament is below. Right? So to the posterior superior iliac spine, posterior superior iliac spine give attachment to sacrotuberous ligament. Sacrotuberous ligament. So we have our sacrotuberous ligament in this area. Right? Now let's go ahead and talk about the the we have three surfaces of the ilium. We have iliac fossa, gluteus surface, and sacropelvic surface. So the sacropelvic surface has two parts. We have the sacral part and we have the pelvic part. So the sacral part is one that contains the auricular surface that articulates with the auricular surface of sacrum, and also it also contains the tuberosity of the ilium. While the pelvic part is one that contains the smooth part that is related to the pelvis, and this gives attachment for the obturator internus. It gives attachment to the origin of obturator internus. So this area gives attachment for obturator internus. Yes. So this is our ischial spine, our greater sciatic notch, our lesser sciatic notch. Our greater sciatic notch is converted into a foramen by a ligament, and that is sacro. The ligament attached this way, it goes up, and that is our sacrospinous ligament. Sacrospinous ligament converts the greater sciatic notch into a greater sciatic foramen, and our lesser sciatic notch is bridged also and converted to a foramen by the sacrotuberous ligament. It goes this way. So we have our sacrotuberous ligament, sacrospinous ligament. So attached to the ischial spine, we have three structures. We have sacrospinous ligament, we have levator and we have coccygeal muscle. So I haven't talked about the ilium. Let's go ahead and talk about the pubic bone. So the pubic bone has three things. It has a body, it has a pubic tubercle, and it has a pubic crest, right? So it has three surfaces. We have anterior surface, posterior surface, and medial surface. Anterior, posterior, and medial surface. So this is our anterior surface, our medial surface, and our posterior surface. Again, anterior surface, medial surface, and posterior surface, right? So the lateral end of the pubic crest projects to form the pubic tubercle. This is our pubic crest. So the lateral end project. Can we see this elevation here? So this is our pubic tubercle. This is our pubic crest. The pubic crest is just superior to the pubis bone or to the pubis. This is our pubic crest, and our pubic tubercle, which is an elevation of the pubic crest. So this is pubic tubercle, right? So this is the pubic bone. We also have pectineal line. This is the pectineal line, and this is our iliopubic eminence. Can we see this roughened area? This is our iliopubic eminence. This is our pectineal line, our iliopubic eminence, and the iliopubic eminence separates the pectineal line from the arcuate line. The arcuate line is a rounded part from the medial border, right? So this is the arcuate line. This is the pectineal line, and this is the iliopubic eminence, right? So that's basically all about the pubis, and this area that I'm touching gives attachment for pubic symphysis, and the type of joint it forms is a secondary cartilaginous joint, right? Ischium. So the ischium is the third part of the pelvic bone, and it has three surfaces and three borders. So the surfaces, we have the femoral surface. This is where our femur articulates. So this is our femoral surface. We have the dorsal surface, and this is the dorsal surface. And we have the pelvic surface, and this is the part that is associated with the pelvis, right? So these are pelvic surface, or it's associated with the true pelvis. So these are pelvic surface, femoral surface, posterior surface, and pelvic surface. We have three borders. We have anterior, lateral, and posterior. So this is anterior border, this is lateral border, and this is posterior border. Again, anterior border, lateral border, and posterior border. So on the dorsal surface, we have our ischial tuberosity, and this is our ischial tuberosity, and it's also referred to as a sitting bone. But the ischial tuberosity is divided by a horizontal ridge into the upper quadrangular and the lower triangular part. The upper triangular is now further divided by an oblique ridge. As you can see, there is an oblique ridge in this place into upper lateral and lower medial. Upper lateral and lower medial, while the lower triangular is divided by a longitudinal ridge, just a longitudinal ridge like this, into inner and outer, inner and outer. So to each of these parts, we have attachments there. Here, we have a semi-membranosus muscle, which is the upper part of the upper quadrangular area. So this is the quadrangular area, so the upper part of the upper quadrangular area. On the lower part of the upper quadrangular area, we have two muscles. We have semitendinosus and we have biceps femoris, long head of biceps femoris, semitendinosus and long head of biceps femoris. On the outer part of the lower triangular, we have abductor magnus, and on the inner part we have fibrofatty tissues. On the outer part we have adductor magnus, which is the ischial head, and on the inner side we have fibrofatty tissue, and we should note that all these muscles are the muscles that make up the hamstring. They are component of the hamstring muscles. So in addition to all what we've said, we also have our obturator foramen and we have our acetabulum. I've not talked extensively on them. So our obturator foramen, it is formed by the union of the posterior margin of the pubic bone and the anterior margin of the ischial bone and the inferior margin of the acetabulum. The meeting point of the ischium and the pubis is our ischiopubic rami, which is here. So this is our ischiopubic rami, these are pubic bone, these are ischium. So ischiopubic rami, our obturator foramen. And in the obturator foramen, we have this structure. I don't know if you can see it. This structure that is more like a cave. It is referred to as the obturator groove, and this allows for the passage of obturator nerve and artery. So we have our obturator membrane because they can paint the surrounding of the obturator foramen and ask what is attached to that area. So this area give attachment for the obturator membrane. So the obturator membrane attached all over the obturator foramen except where it bridges the obturator groove to allow for the passage of the obturator nerve and vessels. It's attached all over the obturator foramen except where it bridges the obturator groove and converts it into a canal to allow for the passage of obturator nerve and vessel. So when it bridges it, it becomes obturator canal, no longer obturator groove. So this way my hand is saying, we can see that opening. The other part below my hand is covered by obturator membrane except that part that allows for the passage of obturator nerve and vessel. Yes, acetabulum is made up of three parts. We have the lunate surface, we have the acetabulum fossa, and we have the acetabular notch. Lunate surface, acetabulum fossa, and acetabulum notch. So this notch is breathed. We can see this is a notch. It's a notch like this. But when I put my hand, my hand is representing a ligament. So this notch is bridged by a ligament into a foramen, and the ligament is called the transverse acetabular ligament, right? Then our lunate surface or the acetabulum is deepened by the acetabulum labrum. So that deepens the concavity surrounding the acetabulum because they can paint the whole area of this acetabulum and ask what is attached there, and this gives attachment to the capsular ligament of the hip joint. And don't forget the kind of joint that the hip joint is. So the hip joint is a ball and socket synovial kind of joint or variety of joints. So ball and socket joint because it allows movement in several directions, right? So that's basically all. So let's go over it quickly. posterior surface, anterior surface, medial surface, ilium, ischium pubis, pubic rami, acetabulum,